All right, right now, a new potential treatment for autism is generating a lot of attention. It's called leucovorin. I believe that's the way you say it. It's a form of a folinic acid already being used in cancer care, but new studies suggest it could improve communication and behavior in some children on the spectrum. The FDA recently took steps to expand the use, but experts caution the research is still in its early stages. Joining us now is Dr. Cecil Bennett. He's from the Newnan Family Medicine to help us sort this thing out and what it all means for us. Dr. Bennett, welcome to the show.
Thank you very much for having me.
All right, so for people hearing about this, and I hope I'm saying it right, it's leucovorin, right?
Leucovorin, correct.
Leucovorin. Tell us about it.
Well, first of all, we know that autism is a disease characterized by language delay. Folic acid is a vitamin that actually plays a role in the development of language in children. For some reason, children with autism cannot process and metabolite folic acid, and therefore they have language delay issues or language developmental issues. Leucovorin, or folinic acid, is a metabolite of folic acid. It's able to go across the blood-brain barrier to those language centers, and we've seen in 2 small studies that it actually has improved the language skills in children with autism. We should note, though, that this is an off-label use. As you mentioned, the drug was initially approved for use to treat side effects in patients taking chemotherapy. Mm-hmm. So this would be an off-label use of the drug.
So how is this different from I mean, I think people take folic acid as a supplement, right? Is this one different than that?
This is the difference is that children with autism, or at least some children, have issues in processing that folic acid. Folic acid needs to get into the brain or across the blood-brain barrier and get to those language centers. And in kids with autism, it cannot get across the membrane. But folinic acid, which is a derivative or metabolite of folic acid, actually can cross. So we're finding that folinic acid actually can improve language skills in children with autism.
So there are some studies showing some improvement. What do we know about those?
Well, here's the thing, all right? There have been 2 small-scale studies, the most being as many as 80 participants. It's been promising. Children have improved. The reason why we need a larger trial or phase 3 trial is that there's a lot more data that we need. With a trial with only 80 participants, we don't really know what's the correct dose. How high can we go? How high is toxicity? What ages do we start at? What weight do we start at? Does it last for 1 year, 2 years, 10 years? This is why long-term studies are necessary, but I can fully understand why the FDA moved forward to approve this drug off-label. Well, really it's not approving it off-label, but allowing it to be used off-label, because it is looking promising in children who have autism and language issues.
Of course, that's good news for folks who suffer from this, obviously, but you got to think about the side effects as well. Are there any side effects that we know about?
And that's the problem, right? We only have small studies with as many as 80 participants. A phase 3 trial will have as many as 800 participants. We'll have a bigger pool and we'll have a better idea of any type of toxicity. This is why larger trials are necessary. And I know parents get upset sometimes when drugs may seem to be promising and the FDA delays, but believe me, these large-scale trials provides a tremendous amount of information and can only keep our children safe if they're done correctly.
I was going to ask you that. You practice family medicine. Folks come run into your office. They hear about this new drug and this new treatment. They come to you and you say it, and you have to now kind of calm down. What do you say to them?
Again, I'm going to, in this case, because of the initial studies, for any of my children who do have autism, I would use it cautiously because of what I'm seeing in the science, but very cautiously. I really need to see bigger studies in order to be more comfortable in using the drug.
Well, we got 30 seconds left. Anything you want our viewers to know about this, I'm going to say exciting new information?
This is something that we should know, that we should be careful if Big Pharma studies this drug, because if they study this drug and do the phase 3 trial and bring it to market, it's going to be a branded drug, and all of a sudden the cost may shoot up by 1,000-fold because they did the research. So it's very important that the CDC or the FDA or the NIH actually takes the lead in doing this research, that Big Pharma doesn't come along and all of a sudden this drug that was easily accessible becomes inaccessible to children who have autism.
Gotcha. Dr. Cecil Bennett, thanks so much for your insight today. Thanks for joining us.